Greetings, attendees at this session. My name is Peter Berman. I'm a professor at the School of Population and Public Health at the University of British Columbia in Vancouver, Canada. And it's my pleasure to be able to introduce you to some of the concepts that we have been using in our work on the upstream factors that may help determine the effectiveness of government response to COVID-19. I'm going to start by sharing my screen, and I trust that you can all see that now. I'm going to place myself up in the upper corner. And I want to also acknowledge the work of our team at UBC that has been developing our work on what we call IOGP, the Institutions, Organization, Politics, and Governance factors that can help us better understand government responses to COVID-19. And the names of my colleagues are listed below on this first slide. So I'm going to begin with a few very well-known observations. Not surprisingly, as you can see in this chart, which is fairly up to date in February 2021, there's been a huge range of experiences in countries in terms of cases shown on the vertical axis and deaths due to COVID-19 shown on the horizontal axis, corrected for population size. And so we see a huge diversity in country experiences, and many factors have been thought to explain some of these differences. Another interesting observation comes from the development in 2019 of the Global Health Security Index, which was intended prior to COVID-19 to tell us how well countries were prepared to confront a pandemic of communicable diseases, as well as other public health disasters. And interestingly, there has been widely reported little or no correlation, that is a negative correlation, between the impact of COVID-19 and countries' preparedness as measured by this Global Health Security Index. This chart indeed shows that there's something of an even positive correlation, which maybe is even more disturbing. That is, countries that were deemed to be better prepared for a pandemic like COVID-19, in fact, have experienced worse outcomes. This is another version of the same kind of analysis a little bit later from the OECD. The blue bars show the countries of the OECD organized according to the Global Health Security Index rank, and the orange bars show a cumulative rank measure of the impact of COVID-19 outcomes across countries. And you can see again something of a very weak correlation between these things. Countries that had some of the worst outcomes were ranked best in terms of the GHS index, starting from left to right, 1 to 36. This next slide links data on the stringency of implementation of government measures with the outcomes of countries in terms of infection rates. And we can see also that there's a weak link between the stringency of government measures and the impact on populations in terms of infections. So these observations led us at UBC to be thinking about what might be other factors that will explain the effectiveness of government response, not simply those related to the adoption of interventions, the stringency or the level at which these interventions are actually implemented, which has been measured and widely reported by a group at Oxford University, and of course the outcomes in terms of cases, hospitalizations, and deaths. This chart represents the conceptual framework that we have been developing to try to understand where these IOGP factors fit into this broader picture, and also where data and evidence might be needed, where we lack information to actually understand this relationship. So starting on the left-hand side, you can see our identification of broader contextual factors that certainly vary across countries. These include things like income and education differences, household structure, which is quite important in different socio-cultural environments, and other broader contextual factors for which there is quite a lot of secondary data, national and even subnational indicators available internationally. Moving further to the right, the next box talks about politics and institutions. And here again, there is quite a reasonable amount of global measurement available to characterize different kinds of political systems, state and regime structures, and also the associated rules of conduct. So for example, whether the results of democratic elections are followed, the degree to which citizens may have voice through legislature and other mechanisms in public sector decisions and so on. Next, to the right of that are organizational actors. And here we're concerned particularly about the role of the public health system organizations in national health systems. Things like, how is the public health department organized? How is it related to those who run the health services, the health authorities, hospitals, and so on? Where are the research institutions located? And here we find that there is actually not very much comparable data available to allow us to distinguish across countries or jurisdictions what is the organizational structure of the public health system intended to be deeply involved in the response to COVID-19, and also what are some of the factors that drive its behavior and its effectiveness. Moving again to the right, we have a box labeled governance. And this is where we are particularly concerned with understanding the processes through which political organizations and institutions work with the organizational actors in the public health system to take decisions about what to do in response to a crisis like COVID-19 and to implement those decisions. And here again, we find weak information about the processes that might link the political and institutional level with the organizational actors. And these things, of course, then translate into the actual interventions, what is done, how effectively they're being implemented, their timing in relation to the epidemic development, and finally, the impact of these on the outcomes. And for those two areas, there also is excellent international data available. It has many problems. As we know, confirmed cases of COVID-19 are not measured or reported in the same way in different countries and so on. But there certainly are data to work with from WHO and many other organizations. So our framework really focuses on the three boxes in the middle: politics and institutions, organizational actors, and governance, and then tries to collect information on these things and link them to the interventions, stringency, timing, and the outcomes. Briefly, definitions of these IOGP factors. Political factors, we consider the political actors and their position in relation to civil service and technical actors. How do the politicians and the political process support or constrain effective public health action? Using institutional and political analysis to understand that. The institutional, again, linked to that, more like the definition that has come out of institutional economics, looking at the rules of the game. What are the bases through which political structures and organizations behave, and what are the norms that affect their behavior and relations to each other? The organizational analysis relates more to the structure of the public health organizations. Where are they located in the health system? What are the lines of authority? How are they organized? What degree of complexity and fragmentation? And very importantly for the governance, who is at the table for which decisions and implementation actions, and what are the authorities and accountabilities that influence them? This to be analyzed as part of an organizational analysis. And finally, the governance level we want to look in some detail with both with qualitative and mixed methods approaches at the processes of decision-making and implementation of actions that enable governments to carry out their objectives. How are key decisions reached and actions enabled? And what is the role for the institutional, political, and organizational factors driving these processes? And in our approach, we want to get at this information using both media reports, but also key informant interviews related to key decision points in the progress of the pandemic in different jurisdictions. So behind all this is the idea of developing jurisdictional case studies. And this is what we've been working on and what our colleagues will shortly present in the rest of this session. I want to start by emphasizing that our goal for these jurisdictional case studies is really to learn from the experience of this truly global pandemic what might be better and worse practices related to IOGP factors that could help us improve the current and future response, both nationally and globally. This relates to the observation that public health systems, the organizations and structures, and the laws and regulations that place them in government and relate them to political structures are not well understood, and in many parts of the world are still under considerable growth and development. So there's an important opportunity to learn from this year's events how we could do this better in the future and how this would relate to better decision-making and implementation of interventions that will affect the outcomes we care about. In order to get at these things, these jurisdictional case studies will look at several different elements: broad contextual factors, as mentioned, the political and institutional analysis, as proximate contextual factors, and this is new in bringing this into the conversation, the organizational analysis that helps us identify the organizations, the structures, and their linkages to decisions, also a new level of analysis, and developing what we call a downstream timeline of epidemic progression, cases, hospitalizations, mortality, looking at interventions, looking at their implementation and stringency measures, but doing this using available data, but with the goal of identifying key decision points that can be the subject of our more detailed analysis of governance processes to help understand the role of IOP factors in taking decisions and in implementing those decisions and the effectiveness of implementation. And this is also a new level of analysis. Thank you very much for your time and attention, and I look forward to the presentations from my other colleagues. Thank you.